This month, News 3 is raising awareness on men's health issues and funds for the Movember Foundation. Today, we are talking about prostate cancer.
So aside from skin cancer, the American Cancer Society says prostate cancer is the most common cancer in American men, and it is one that develops more often in African American men and in Caribbean men of African ancestry than any other races.
Investigator Zach Dahlheimer digs into the disparities and shows one type of treatment that's having an impact on men across Hampton Roads, including one of our own here at News 3.
Derek Williams is one of the faces of News 3, one you may not see on TV, but working hard behind the scenes, a man passionate about his career and his health.
I said to myself one day, let's get serious about this.
In 2007, Williams decided to get routine blood tests, including a PSA test standing for prostate-specific antigen used for prostate cancer screenings. His levels came back high, and after further testing, he got the news that changed his life.
When the doctor tells you you have prostate cancer, what goes through your mind?
I was in shock, though, Zach. I never had cancer. Nobody in my family had cancer.
According to Memorial Sloan Kettering Cancer Center, prostate cancer takes a harsher toll on black men than other American men, including other men of color. Black men are 50% more likely to develop prostate cancer and twice as likely to die from the disease. The reasons for this, they say, are not fully understood. As for Williams, he got to work looking at treatment options, which led him here, the Hampton University Proton Therapy Institute. The center has been seeing patients in Hampton Roads since 2010. Right now, they're currently treating about 65 patients a day.
We really cover the gamut of cancers other than blood cancers. So we do see quite a few patients bringing themselves in just for a second opinion.
We're really a physics laboratory in disguise.
Dr. Alan Thornton is one of 2 radiation oncologists at the Institute.
Now, you may wonder, how long exactly does an appointment take here at the Institute? Well, Dr. Thornton says usually from start to finish, for patients, it's about an hour. Now, as to how long the exact proton therapy treatment takes, that's just 2 minutes. But what patients see behind me here, this is just the tip of the iceberg. This is the iceberg.
The advantage of proton therapy is we can stop the beam.
Thornton says this also means doctors can help spare surrounding organs and the spinal cord during treatment sessions. He tells me another advantage with proton therapy versus other forms of cancer treatment is a greater quality of life and much less side effects. And the success rate with proton therapy has been pretty good.
For early stage prostate cancer, the cure rate can vary from 92 to 99%. So it's a very, very curable tumor.
This month, the Institute will also start night treatments to get another 12 patients in per day.
Well, number one, it's making it accessible.
Bill Thomas with Hampton University says the center overall is helping make more healthcare options available, especially for African American patients.
So about 30% men and women who attend this great facility are of African American descent. That is unheard of with new technologies and new medicine. We're just trying to ring the bell loud enough so people can save their life, but most importantly, sir, you don't have to live your life in misery.
And ringing the bell is what Williams did after a few months of treatment sessions.
You're 15 years disease-free. What's that been like for you?
Right now, I'm a normal person like I ain't never had it before.
Williams is now an advocate for men's health, emphasizing the need to get tested.
It needs to be done. Cancer, it's not a black thing, it's not a white thing. Cancer is cancer. My man, Zach.
Now, the American Cancer Society recommends having a discussion about screening for prostate cancer if you're 50 and at average risk. If you're at high risk, that should start when you're 45. And this includes African American men and men who have had a close relative, such as a dad or a brother, diagnosed with prostate cancer at an early age. Now, we have a link to more information on screening right now at our website, WTKR.com. Zach Dahlheimer, News 3.